if you see that whenever we take out the bone marrow, the most important thing is to filter it first. Okay, so in this case you can see that I am using the 200 micron filter which is currently available with these CDSU approved kits. And once we have the filtered bone marrow, we have one step system that you just centrifuge it on 4500 RPM for 20 minutes and you get 3 layers. The downmost is the RBC, then buffy coat is there, and then plasma is there. So you have to just remove all the plasma, top one, except last 4 to 5 ml, and you just slowly rotate it so that all the buffy coat mixes in that, and that is ready to be used in your cases. We got it tested also in various labs, and we have found that the final product is having about 23 billion mononuclear cells, which gives the regenerative effect. And if we are going to use roughly 5 ml as intrathecal injection, so it is around 120 million cells. If we go through the literature, we found that even from India this paper was published regarding the Autologous bone marrow-derived mononuclear cell therapy for spinal cord injury phase 1-2 study in 2009, and they found that it is safe and 1/3 of the patients respond to it. Later on in 2014 there was another study of the same thing, and they did it through lumbar puncture and they found it safe and feasible. In this meta-analysis in 2015, they found that BMDC transplantation appears to be safe and valid in spinal cord injury patients, but it is more effective in chronic and complete injuries. This is important finding. In another study, they have used bone marrow-derived mesenchymal stem cells, and they have given 3 sessions of the 100 million cells in each session, and they found that it shows efficacy in patients with SCI, mainly in recovery of the sphincter dysfunction, neuropathic pain and sensitivity. In this also comparative study of the different types of the stem cell transplantation for spinal cord injury in a systemic review and network meta-analysis, they found that the BMSC plus the rehabilitation might be superior to other stem cell transplantations of SCI in improving the ASIA impairment scale grade, ASIA motor score, ASIA sensory functional score and Barthel index. In this recent paper, they showed that the transplantation of the autologous bone marrow-derived mononuclear cells into CSF, it causes the activation of the GAP43. GAP40 is growth associated protein 43. It is a protein which is involved in the axonal elongation, an important process in spinal cord regeneration. And you can see that GAP43, these are the white spots which you can see along the line of regeneration. Now I will show some of my patients, like this patient who was having fracture D12, L1 and L3. Okay. This patient again, you can see when came, she was having hardly movement in the left foot, and then within 3 months the actions, movements in both the lower limbs. And this patient again, which is ACIA D56, improved within 3 months of cellular therapy. This patient is very important, gunshot injury patient, paralyzed neck down, 32 years back, start walking again after BMAC transplant, just 2 sessions. So, take home message is, autologous bone marrow MNCs transplant is a viable treatment for spinal cord injury cases if they are not recovering substantially within 6 months of the injury. It promotes repair and regeneration of the various tissues, including muscles and neurons. It decreases the inflammation and promotes tissue regeneration, thus helping improving the quality of the life.